Good morning, everyone. Welcome, and thank you for joining Advizex today for our webinar, 3 Ways to Support Your Hospital's COVID Response. Quick housekeeping item before we begin. Please feel free to submit any questions through the Q&A chat box, and we'll answer all questions at the end of the presentation. For those of you who aren't as familiar with us, Advizex is a solutions and services-led IT provider. We have been a trusted advisor for our customers for over 40 years, helping them accomplish their IT and business goals through best-of-breed customized solutions. A large portion of our customer base is in the healthcare industry, where we focus on solutions that align with the quadruple aim. In this presentation, we will discuss 3 main areas: enhancing your telehealth options, presented by Brett Wade, Principal Consultant; positioning infrastructure services, presented by Dave Bossy, Enterprise Architect; and shoring up your security posture, presented by Jay Martin, Enterprise Architect. So I'm going to go ahead and pass it over to Brett Wade to get us started.
Thanks, Nicole. So the first topic we wanted to discuss today is around telehealth, and so obviously a lot of you are already working on telehealth efforts and have things underway. So this isn't really to rehash that for folks that have already begun that journey, but it's really just to talk through some other things to think about around telehealth and thinking about ways to expand and improve on those telehealth efforts to better enable your hospital. So the first thing I'm going to talk about today is really just walking through some areas specific to COVID where you can be thinking about how to leverage telehealth or maybe expand what you're doing in telehealth. Certainly from a remote triage, right? If you're not doing it today, thinking about how you can enable patients to ask questions via telehealth. So think about kind of those urgent care situations or folks who think they may have COVID and kind of doing that pre-screening. So whether you're doing that through a more traditional consult or whether you're enabling a chat bot so someone can go on and run through their symptoms, basically it's a way to sort of keep people that don't have COVID from being exposed in the hospital or that maybe just have mild symptoms from needing to come in. Along with that, of course, thinking through other types of visits that you might be able to manage through a telehealth type offering, such as a well child visit, prescription refills, basically those basic appointments where they could conceivably be handled with low to no touch. Also thinking through really home care scenarios, so individuals that are needing to do post-surgery follow-ups, some of those can be handled through telehealth. And for those patients that have been diagnosed with COVID and so need to remain quarantined but are really exhibiting mild symptoms, setting up some remote home monitoring, right, so that those types of patients can make a report on their daily vitals so that they can be monitored by a doctor, but there's not necessarily need for them to be in the hospital setting. They can remain in quarantine. And finally, right, as many hospitals are working and caring for COVID patients, a lot of those same doctors or that work in those same hospitals are having to go out to nursing facilities, long-term acute care facilities, and the like. And so if you think about those doctors that are actually caring in multiple settings, being able to enable telehealth so that some of those care events can happen remotely, that way you're not risking as much exposure. Again, these are just other thoughts on ways to leverage telehealth. Many of you are probably doing some of these things already. But what I really want to talk about today is talking about the whole cycle of implementing telehealth, and I think it's important to realize that what we're really talking about here is a cycle. It's not a one and done. You set up your webinar and you're good to go. Certainly we've seen with the relaxation of some of the rules around HIPAA reporting there, it opens up some additional options. What that landscape is going to look like post-COVID. We anticipate a lot of things going back to the way they were in terms of security. So thinking through some of that now and how you can be preparing for the security procedures you're going to need to have in place in the future, but maintain the investments you're making in telehealth now to expand and enable what your facility is capable of doing. So I'm going to go through a few areas today. I'm going to talk through aligning the technology. I'm going to talk through training staff, talk through how once you have staff trained, the communications with your patient, and of course, just reemphasizes this is an iterative process, right? So that continual feedback that you're soliciting from patients, from providers to understand what new technologies you can add and how you can improve those efforts. So first, thinking about aligning the technology with the clinical direction. So obviously different hospitals have different approaches on how aggressive they want to get with expanding into telehealth and expanding into remote care opportunities. So thinking through what the hospital is ultimately looking to accomplish is really step one. There's a lot of technology out there and a lot of ways to align that with the clinical direction. So understanding how the hospital wants to pursue it is sort of step one. I think most of you all know that. Some things that we just want to throw out there for consideration, right? Thinking about encounter types. So what kinds of encounters would you ideally want to handle in a more remote fashion? Sometimes it's broader than you may think, right? When you start thinking beyond just the teleconferencing, do you want to start capturing biometrics remotely? There are tools out there to help connect, basic monitoring tools into a telehealth experience so a doctor that is working with a patient can see their vitals remotely. Certainly there's things around wearables with capturing that sort of data. And texting is becoming a big part of the telehealth scenario in light of COVID as well. CDC actually has a recommendation around leveraging texting as much as possible just because of the receptiveness of the patient population to texting as a form of care and advice giving. So we certainly recommend that you look into that as much as you can. The big important thing here as you're looking through and aligning with the clinical direction is to, as you're looking at potential technology solutions, understanding what the impact on how the care is administered, what that impact is going to be so that you can design your training programs and your patient education to align with that. And also, of course, making sure that telehealth integrates with the other systems. At the end of the day, you don't want this information having to be turned around and transcribed as you're collecting data remotely or as you're having those telehealth visits. You want that information getting plugged into your EMR and other systems, so thinking through that. So as we, after you align with the strategy and as we've kind of defined a direction here, certainly the next thing to think about is around training staff. And the biggest thing we want to emphasize here is around not underestimating the change. Even if all you're doing is rolling out video conferencing, there's definitely more to rolling that out than just saying, okay, now video conferencing is an option, right? So in other words, thinking about those clinical protocols that are in place, thinking about how nurses or doctors will actually access that technology, and do they need to be equipped with cameras? Do they have workstations that are equipped with cameras? Are those workstations set up in such a way will secure privacy of other patients? And are they appropriately set up for the audio side as well? So those are all things to be considering in terms of setting up the strategy and in terms of setting this up from training staff. Even small changes can be big for staff. So working through everything that staff needs to be trained up on becomes really important. Looking for those one-page instructions to really help make it easy and quick reference for staff, offering multiple training sessions so staff that are working for us have multiple opportunities to get trained or to get retrained, identifying those power users on the floor that can actually help with some of those immediate staff issues. And then most importantly, right, is recognizing that there'll be continued issues or technical challenges that staff may have and making sure that IT is staffing up appropriately to meet those challenges and just to provide a higher level of support to clinical staff who may have technical issues. So really important that you're freeing up resources appropriately so that you can provide that technical support. And so finally, when you're thinking about pushing out your telehealth efforts, you've got your technology defined, you've aligned with your clinical side, and you've trained up your staff. It's really about that patient communication. So certainly, right, starting out off your telehealth efforts small can really help with the patient communication. It makes it really simple on what you're communicating with patients to do. And I think that's where a lot of folks are today. And so the question is, how can you expand on what you're already doing to broaden out what you're doing from a telehealth perspective, and especially in the current climate, keep people from needing to come into the hospital for different services, but even going forward post-COVID, right? What is, how can you make this part of your daily routine? So starting small, but having some things that patients can do remotely is really key. And then being proactive in your communication and outreach to patients to try remote visits and looking for ways to do telehealth with those patients remotely. Also important with patients just as much is that technical support. So how do patients get access to technical support if they're having trouble connecting so they can make their appointment? So obviously, especially in the healthcare environment, it's important to keep in mind that this is really a stressful time for a lot of folks, including your patients. So having patience with your patients is another thing to be mindful of. From a patient communication perspective, we've talked through a lot of things that you need to do to prepare there with your patients. Certainly thinking through how you schedule is important. One thing I really want to call out there is, as you're working with patients, is making sure that you're still being mindful of connecting them with the appropriate community resources. So certainly those low-income patients, there may be ones that don't have reliable access to internet, and especially with libraries being closed, there's a good chance that they may not, they may not have any options. So looking for community resources that you may have locally that can help get them connected to internet can be, a lifeline. One program I will call out that's part of the FCC's Keep America Connected pledge is through Comcast Internet Essentials. So if you have Comcast in your respective area, the Internet Essentials is a program that Comcast has released as part of COVID to provide free internet to low-income households. But you can also go to the FCC's Keep America Connected pledge site to look at other programs that other providers are providing. So with all this, as you set up your telehealth strategy, I'm going to turn it over to Dave, who's going to talk a little bit about, from an infrastructure perspective, what else needs to be done to, as you face this new environment, to make sure things continue to run smoothly. Thanks, Dave.
Hey, thank you, Brett. I appreciate it, and appreciate everyone's time on the call. I'm sure that everyone is very busy as we define what the new normal is going to be as it relates to infrastructure and infrastructure services. So what I'd like to do is take a little different approach. I'm sure many of you have been really focused on hardening your infrastructure, increasing infrastructure capacity, and so forth. So the perspective here for this section of our conversation this morning is really focused on how to leverage the information and the knowledge gained over the course of the last several weeks to best position your organization from an infrastructure perspective for the future. If we can go on. So first and foremost, infrastructure and operations teams are service providers. Many of you that are in the service side of IT service delivery certainly recognize and appreciate that. However, it is truly a perspective that needs to be reminded to many individuals throughout the organizations that being a service provider and providing services to both internal and external clients, there's a perspective that needs to be kept with regards to ongoing investment, the challenges, and maintaining a proper service delivery organization from an infrastructure and operations perspective. So with that in mind, looking at where we are today and the challenges that we've all dealt with over the course of the last several months, now is a really good time to validate the infrastructure within your respective organizations from a scalability and a capability perspective. Not just from a capacity perspective, but really understanding what the demand is on that infrastructure, gathering that information, those metrics, and really taking a close look at what could be better planned for and better utilized in the near future. There's also a very specific need to be able to prioritize demand on your existing infrastructure and your operations organizations, specifically around understanding what those critical business processes are, understanding the utilization requirements around those, and certainly the physical infrastructure capacity around compute, storage, networking, and so forth. This is also an opportunity for organizations to leverage the information that we've gained over these last several weeks to update those services playbooks. If you don't have a services playbook within your organization, it is certainly the time to build that, to really understand what those workflow requirements are, not just internally anymore. Obviously, the demand has really pivoted towards external access to those processes now that are being managed and delivered in a full remote situation. Next is looking at cost models and the tracking of costs. In our experience, many of our organizations do a reflective view of the financials around the delivery of services, both infrastructure and operational services. Now, in a real-time mode, you can true up those cost models and really understand the delta between what was projected and what your actuals are in support of infrastructure and operation services, as well as get a clear understanding of what those costs are today to deliver those services in the current state as well as in the future state as things start to emerge and we're in more of a blended environment with a greater demand for external access for internal customers of operations and infrastructure services, as well as for clients to provide data and access to critical infrastructure to provide the customer service that your service organizations own. Last but not least is to leverage the data for the cost of those services to improve service delivery. So again, looking at the financials, looking at the information that's now available within your respective organizations around utilization, the demand for scalability, your peak demand periods, understanding how those peak demand periods align to the prioritization of services that you deliver, really allow organizations to have that view, that perspective of how the organization needs to operate and can prioritize going forward when it comes to budgeting, when it comes to forecasting, and when it comes to the continued investment in infrastructure and operations. So there is hopefully no longer that need for that sudden ramp up of infrastructure and operation services, that there's a more clear understanding of the need to maintain critical infrastructure and operations going forward. In summary, to be able to focus on those 5 items, again, this is not the time for something to be very complex. Our goal here and our recommendation is to keep things simple as it relates to in-demand services, defining some very basic metrics for accounting of your scalability and capability needs for prioritization of services. A playbook can be a very simple tracking tool to really understand what those services workflows are and include that prioritization based on actual demand that's being accessed today. And then associating those costs with those, right? You have the ability now to see what your investments have been to either ramp up infrastructure or to increase capacity from a demand perspective, both on infrastructure as well as operational concerns. So now's a great time to do that, and again, keeping that simple. I note here about not getting lost in automation and a variety of different tooling capabilities that are out there. DevOps and the various DevOps tools that are available to our organizations to operationalize some of the more repetitive or to help integrate services and processes into existing service management tools and so forth are great. But again, now might not be the best time for most organizations to divert resources from maintaining critical infrastructure and operations to automate in any level of or any degree of complexity. So again, we just it's not that that might not be something to do in the future, to where a lot of the gathering of information and critical data is subsequently automated. The collection of that information or the triggers associated with those are not automated. But for right now, again, it's best to just try to get your arms around that information. And then last but not least, do this, and then we can talk about iterating this, right? So, the goal here is basically action and taking action to focus on your critical infrastructure and operations, as opposed to lots of conversation and lots of discussion and adding complexity to what's already a rather hectic situation for many within your field of expertise. So we mentioned the ability to really focus on your infrastructure and the prioritization of services. What we wanted to provide here was a very simplistic model that can be used for an infrastructure services catalog. Again, keeping it simple, not trying to overcomplicate things, but collecting information regarding your workloads, your networking services that are available to you. You can certainly expand on this to include operational activities and so forth, but just starting to collect that information. A services catalog for infrastructure does not have to be super complex and take a tremendous amount of time to prepare or to lay out. But the value of the information that you're collecting and the potential use of that information for better decision making and to improve your service delivery around infrastructure and operations is what the real goal is. We can always go and expand and add additional detail and focus on segmentation of your infrastructure and your operational services to further refine a services catalog for infrastructure down the road. But for right now, our strong recommendation is keeping it simple and just starting to collect this information so you have it for future reference. So getting back to my earlier comment around, focusing on key processes that pull demand from your infrastructure and operations, we really strongly suggest a focus on those in-demand infrastructure services as a key priority initiative for infrastructure and operations leadership. Focusing on, prioritizing that demand, ensuring that, those services are focused in on by the team, that there is a real clear understanding of those critical services for the organization, and ensuring that that proper demand is tracked associated with those services, and that those services are identified as key in association with the metrics around those services. Again, to ensure that, as things start to emerge into a new normalcy, that those priorities that have been identified during these critical times are maintained and supported from an ongoing perspective. Standardize from a document, from a workflow perspective with regards to the documentation of those services is another key area of focus, ensuring that there's a clear understanding of those workflows that have been identified, that there is a standard means to support those processes and those workflows with regards to the skills and the roles, the folks that are involved in managing and maintaining those particular workflows, and obviously the technology that supports those workflows. And then, as we mentioned earlier, the metrics around that, collecting of that critical system data. Now that again, we are in a state of managing and maintaining the infrastructure and the operations supporting our new normal. Again, gather that information, make sure that it's not being overly complicated, but that the information is being preserved and something that can be charted and reflected upon accordingly as you start to plan out future infrastructure and operational investments as we go forward. So, updating those services playbooks, again, I'll reiterate, if you haven't already built or do not leverage a services playbook for infrastructure and for operations within your organizations, we strongly encourage you to do so. The services playbooks, again, are a means by which to take the information collected around critical processes, the infrastructure and the operational activities that support those processes, the capacity and the utilization that those processes demand in order to be viable for your customers, both internal and external. This is the opportunity to collect that information, and to do that, you need a services playbook for your organization. And we strongly encourage you to focus on gathering the information and or updating your existing services playbooks if you don't already have one. Use this opportunity to clarify those infrastructure capabilities and to align that to your service level requirements. That sounds like something that is reactive. It sounds like most organizations should do that through the normal course of business review. What we tend to find is that that's not the case. That this is a once a year type of activity around service levels and alignment of service levels to the organization's real needs for uptime. So now's an opportunity to really reflect on that and to really leverage that information with your counterparts on the business side of the house. Standardization of your infrastructure in terms of how you deliver. Again, looking at templates, your delivery models, and standardizing and simplifying those and allowing that information to become part of your normal process. Again, trying to not overcomplicate how services are delivered, how infrastructure is configured, standardizing on that, standardizing on conventions across the board. In times like this, certainly allow for the organization to scale much quicker, but in addition, allow for the organization to better control the environment and better understand the infrastructure services that are being supported for their environment. The next item is would almost be a given, but those strategic infrastructure decisions and making good infrastructure decisions really should be based on the information that you're collecting throughout your infrastructure and operations activities. Again, referencing back to the playbooks, leveraging your monitoring capabilities to really understand where future investment in your infrastructure needs to lie in order to best align with those prioritized processes that you're now supporting for your organization. And in many cases, in a very different state than what was initially planned for delivery of those processes and services. And then the automation of those processes, again, this is not to overcomplicate, but as you standardize processes across the board, you can dramatically decrease the amount of resource and overhead associated with the implementation of those processes through some basic automation. So again, not trying to overcomplicate or force something that you may not already have, but as you really standardize your services playbook around infrastructure and operations, what will emerge is opportunities to automate across the board. So looking at cost, this again is in most organizations tends to be, an annual process for budgeting and then maybe a quarterly review. Now's a real opportunity to really focus in on the cost of supporting your organization in the new normal, and comparing that back to what was projected under the delivery model prior to the last month and a half. So, really being able to track those costs is really integral for you being able to focus on creating efficiencies within IT, whether that's reallocating of dollars through automation, potentially being able to shift dollars from certain areas. And we tend to look at that, from a cost management perspective, that, it's not a matter of just moving dollars. It's, really a matter of having a well-managed infrastructure and operations team if there's a clear understanding of the costs associated with the service delivery. So again, we strongly encourage our clients, and what we're really seeing with organizations that we engage with is that cost management is really a high indicator of an organization's ability to really come through situations like we're in today, and then leverage that costing information to really better plan for how their organization from an infrastructure and operations perspective is going to operate, and the cost to provide that service, what that cost is going to be to their organizations going forward based on those priority processes and services. So there's some real practical ways that infrastructure and operations can achieve this. First and foremost is to just build and leverage, some internal run sheets that can at least start to track, if an organization doesn't have that information already, the cost of providing services in the infrastructure and operations areas. So if you don't already have that information, I strongly encourage that there is a clear tracking of information per service, per priority service that's being delivered, and really understanding the different aspects across the infrastructure and operations landscape to provide that service to your clients. So again, it's an opportunity to really understand how much is currently being spent to deliver those individual priority services today. Showback from a financial perspective is really taking that information that you've collected and really getting buy-in from the business as well as from other aspects of your IT organizations as to the actual cost to deliver those services across that architecture. Not necessarily getting to the point of where you are looking to charge back. We'll talk about that in a minute, but really just get buy-in on the fact that the cost to provide these services and getting into the granular level of what the total cost really is associated with providing some of the key infrastructure and operations to your organization. Then last but not least, a chargeback model. Many organizations have gone there to where IT is actually charging back within the organization the cost of services for critical processes and procedures. But again, the only way that that can really be achieved is if you have developed, going all the way back to step one here, really developing those internal rate sheets and really understanding what your costs are to support a critical process in detail. So chargeback can be taken to the point of where there's actually that monthly or in some frequency reoccurrence of costs charged out to the consumers of critical infrastructure and operations, but that really starts again by building and leveraging those internal rate sheets and then subsequently getting buy-in on the showback models from a financial perspective to really understand what those costs are. And looking at overall the data that's available to us today, most organizations have rather extensive monitoring and control capabilities today. This is an opportunity to really focus on those effective performance monitoring tools that really address your critical transactions, those critical business processes first. So it's not that we're in any way, shape, or form recommending that there's less monitoring done within the organization, but more so strongly encouraging organizations to put a higher focus on those critical transactions and the supporting infrastructure and operations needs that are in support of those. So looking at those from a priority basis, really focusing on ensuring that those services are defined, that that the supporting financials around those infrastructures and those operational needs is well defined, and really consuming all of that information to provide a very detailed picture of what it costs to manage and maintain that critical infrastructure. Developed those predefined migration or reaction strategies with regards to failure and any type of outages. We really strongly encourage organizations to take a close look at and play the what-if scenarios around those critical processes and procedures in the event that there is an outage or an interruption of services. Again, today, in today's environment, there's been quite a bit of scaling that's been done to provide access to critical infrastructure and operational needs. And we strongly encourage organizations to take a close look at how they've been implemented and to really understand what those potential problem areas could be, capacity, licensing, what have you, and really establish a way for those priority transactions for those particular issues to be mitigated as much as possible. And then last but not least, leverage this data from an optimization perspective to really improve overall performance of those key processes and procedures, to really address cost. And by addressing cost, that doesn't necessarily just mean reducing costs. It means really understanding and clearly communicating the cost to provide the services that are being utilized today, and certainly those priority services. Understanding the features and the functionality of the infrastructure and the operations that's in play today, and ensuring that the information associated with those features and functionality is clearly understood. So with that, I'm going to go ahead and turn it over to Jay Martin to touch on some security concerns.
Thanks, Dave. Thanks, Brett. Appreciate your input there. I'm going to talk about security, not only as it relates to this pandemic and the chaotic situation we've all been thrown into, but as we go forward and telehealth becomes more prevalent, to capture what Brett said earlier around telehealth, and as we move to maybe a new normal with a remote workforce, how to shore up those defenses. So I'm going to talk about three things today. What Advizex is seeing as a threat landscape during this period and going forward for hospitals, healthcare, and beyond. What some of our customers are doing to enable that remote workforce for telehealth, emergency care, remote access, and ways to shore up your hospital security posture. So before I begin, I just want to touch upon what Dave said about the services playbooks. Part of that is, and I'm sure a lot of you on the phone have had to execute your continuity of operations plans or your business continuity plans, is to take a look at what worked, what didn't during those periods, and take some time to shore up those processes, the governance structure around that, aligning the BCP plan with the business, your business impact analysis, as well as aligning it with IT's DR strategy. Those all play hand in hand. It's a perfect opportunity to look at what worked and what didn't as you move forward. So right now, what we're seeing is during this period, the cyber criminals, the threat actors, they're capitalizing on the chaos, right? There's no abatement. There's no empathy for healthcare. Here's on the right-hand side, and I have it circled here. This is a ransomware message where one of the users clicked on a phishing email, unfortunately, and encrypted their hard drive and probably beyond. And I circled, this is just business. We absolutely don't care about your deals. They don't care that, hospitals and healthcare are working to save people's lives, working, overage in hours and trying to, create a safe workplace and perform telehealth. So they're going to use this opportunity to capitalize on spreading misinformation, on fraud. There's a lot of fraud going on right now as it relates to telehealth. They're just trying to capitalize on the chaos and try to slip through the cracks within that chaos, hoping they don't get caught. A few of these bullets here, Google saw a 350% increase in phishing websites set up during coronavirus. And so there really is no abatement. So the message here, guys, is we have to keep diligent around security, not panic, but keep diligent and continue to put in good security practices, even though we had to move fast during this pandemic to enable telehealth and a remote workforce. Before I get into this, I just want to talk a little bit about what some of our clients are doing, what are some of those activities, and why it's prompting some of these good practices for us to be more diligent. Some of our clients here, one of them in the Boston area, is setting up an overflow emergency care facility at a convention center. Obviously, they have to extend compute, remote access to that convention center, and get that up and running so they can access the applications locally within the hospital, in cloud and beyond, right? So again, setting that up in very rapidly might bring in some security concerns for security professionals. Another one of our clients are building out a mass decontamination center to decontaminate up to 80,000 masks per day. Again, that facility is going to need remote access, compute resources, and so on. Other places are loaning out iPads to patients, low-income patients, so that they can communicate to their families. We have a family member in the hospital right now, and fortunately, they have access to a mobile phone to do FaceTime and things like that, but a lot of people don't, so hospitals are kind enough to do that. And so, this mentality of loaning out things, loaning laptops to staff now that are being asked to work from home, right? A lot of this extends the threat landscape that was once maybe to an office, a hospital, or a couple of facilities. Now the physical landscape has increased, and the cyber attack vector has increased. And so we have to be very diligent on that. And it also brings up another point. As we loan out these laptops and mobile devices and so on, and apply software licensing where we weren't before, maybe that meant purchasing licensing, how are we tracking those assets? How are we keeping control of those assets? So when things return maybe back to quote unquote normal, or we need to take back those assets and dispose of them in a proper way because maybe they have PHI information on them or not, and we need to dispose of them in the right way. How are we tracking those today? So one of the things you want to look at is, we had to jump into action. We had to rapidly loan out these devices, but what are we going to do now to be able to centralize where those assets belong and apply some asset life cycle management to those devices in a secure way. So here's some, this slide is all about security priorities within the pandemic. One of the things that I want to point out here is you don't need another crisis on top of this crisis, right? So good security hygiene is very important. And one of those is continuing your end user training and security awareness training, even though your employees are at home, right? So continuing on with that, reminding users on a day-to-day basis not to use USB drives, only use hospital or company sanctioned USB drives, things like that. Again, I just talked about how the physical office has expanded right? So taking precautions for the office, not only offices we left because we can't go back there due to the quarantine, you know, and securing any paper documents or any compute resources, again, USB drives and so on, but also now at home, how are we securing our home? Are we printing things off with patient records and information on them? Are we using shredders to properly dispose of them? So on and so forth. So make that part of your end user security awareness training as you continue on. And last but not least, looking at your security strategy, your policies, and being able to update those policies, you know, post COVID-19. A lot of our clients are getting into BYOD now, bring your own device. They're allowing their end users to use their own devices to do telehealth and access applications and so on that they weren't allowed to previously. So we need to take a look at those policies and update those. Yeah, next slide. So handling the new normal. A lot of our clients, in order to get those remote users access to the applications they need to get access to, they set up, and the IT folks on the line, I understand there's mostly IT folks on the line, have had to set up a remote desktop protocol and allow their remote laptop users to remote into those users' desktops, and then from there be able to access the applications. That's not a good thing, right? RDP, by its very nature, is not very robust, not very secure. There, you know, were a lot of attacks against it last year, things like Bluekeep and such, that may still be unpatched in your environment. Take a look at that and begin to start shoring up how you're doing remote access. RDP is not the way, and there's more mature ways to do that now. So next slide, please. So here's some no-cost ways. As you move off of RDP, you know, you may need to still secure it until you're completely off. And some of the things, no-cost ways to secure your remote workforce is to perform these things on the right here, which is first and foremost patching. You want to make sure that as you extend now your physical infrastructure to people's homes, are people patching their BYOD devices and the devices you've actually loaned them? And oh, by the way, they're also using their wireless access points and maybe their home routers. When was the last time those were patched? Could somebody set up a man in the middle on their devices and, you know, sneak in that way? So a lot of things to think about there. And I won't go through each one of these lists, but certainly another area to prevent exposure through RDP and VDI, any type of remote access, is to enable multi-factor authentication. Hope your organization has done that. If not, here's a good opportunity to revisit that strategy, take a look at some of the technology that's available out there, and put it in as something to do in the near future, because we are moving into a new normal, as I mentioned earlier. So can monitoring help? And I talked a little bit about artificial intelligence in monitoring. You're looking at something called user behavioral activity within the environment. And one of those things is really inspecting logs within your VDI and VPN environment. A lot of our clients, when we do ask the question of how they're monitoring and how they're looking at logs and who's coming in and who has access, a lot of times they're not centralizing their logs, and their logs roll over on those devices. So there's no real way to go back to inspect if there's suspicious behavior, and there's not a way to go back and maybe do forensics if something does happen. So we're encouraging our clients to centralize their logs and to incorporate some level of artificial intelligence to inspect those logs with tools like, you know, Splunk, and other AI tools that can look at normal baseline of behavior on a network and be able to alert on anomalies around that. And there's other products I've listed here, like Fortinet, Varonis. We talked about Splunk already. Scenario for securing IoT medical devices. and in other medical devices. So see, these are some of the tools you may want to start taking a look at and deploying them in a more accelerated fashion if they're already within your infrastructure. And some other back to basics here. I'm not going to go through this whole list, put everybody to sleep, but certainly a couple areas that some of our clients have asked Advizex to do and are doing themselves on their own is as they had to stand up additional compute resources for remote access and to extend out capacity for the remote workforce and telehealth, they want to take a look at performing a security assessment on any new infrastructure that they've set up and take a look at how secure those areas of their network are. One of those things is performing penetration testing and vulnerability scanning on those areas. We highly recommend if you do have tools to do that you do that immediately and remediate any of the issues that come out of that, especially the critical and high issues on your CVSS scores. So you want to do that as soon as humanly possible. Again, enabling logging, we already just talked about that, and bringing those logs back to some sort of security information event management system. So again, you could alert on those and escalate those and triage those as they come in. And feel free to look through this list. It's great for the current landscape and beyond. Good luck securing your environments and continuing to perform that security awareness training to your end users.
Great. Thank you all for joining us today. I just want to take a quick minute to say thank you and thank Brett, Dave, and Jay for your expertise and insight today. I think I can speak for everybody on the line. We definitely learned a lot. So really appreciate you taking your time out to do that for us today. We're a little short on time today, so I think what we're going to do, please continue to submit your questions through the Q&A chat box, and the panelists, they're just going to email you the answers afterwards, so we don't take too much of your time up today as we've already taken a bit. So feel free to keep submitting them there. And we just want to wrap up with a couple key Advizex takeaways for you today. So one thing that we think it's important for you all to understand, we do have over 300 senior technologists, security professionals, and advisors out there and ready to assist you today, not only in supporting your COVID response, but also in supporting your transformation back to normal, or your transition back to normal, or whatever normal will mean after this crisis is over. We also would like you to know we build all of our solutions using our 4-pillar philosophy: adaptive infrastructure, intelligent operations, strategic transformation, and cloud managed services. So we'll just end with this slide today. We want to highlight a couple accolades that we've received from a few of the many of our healthcare customers. So you'll see that on the left here, and then on the right, you're going to see some popular services that we provide for them, along with some others. So we'll leave that for you. We'll leave a couple minutes for you guys to continue submitting your questions. And like I said, we'll get back to you on all of those answers just in the interest of time. Thank you once again for joining Advizex today. Enjoy the rest of your day, and we'll touch base with you all soon. Thanks.